Hi. So the big question that everyone's talking about, the weight loss drugs. Dr. Wellner, I'm taking Ozempic, Wegovy, Mounjaro, or Zepbound. Am I increasing my risk of breast cancer? First, let's define the class of medicines as incretin receptor agonists. And Ozempic and Wegovy, or semaglutides, work slightly differently from Mounjaro and Zepbound, or tirzepatides. There are other drugs in this class of incretin receptor agonists, but the ones that I just mentioned are the most popular that everyone's talking about. The short answer is, based on evidence we have today, we do not know that these medications increase breast cancer risk. In fact, some of the early studies have been surprisingly reassuring. A few studies have even suggested that women taking these medications may have improved cancer-related outcomes, although it's still too early to draw firm conclusions. So where did the concern come from? These medications carry a warning because in animal studies, researchers saw an increased risk of certain thyroid tumors, specifically medullary thyroid cancer. Because of that, these medications are generally avoided in patients with a personal history or family history of medullary thyroid cancer or MEN2 syndrome, which includes thyroid cancer as part of its presentation. But breast cancer is a different question. Right now, there is no convincing evidence that Ozempic, Wegovy, Mounjaro, or Zepbound increase breast cancer risk. Could that change as we gather more long-term data? Of course. Medicine is always evolving. But it's important to know that since the much larger determinants of recurrence risk, as we know today, are likely to be obesity, insulin resistance, adherence to endocrine therapy, tumor biology, and exercise, rather than whether the drug has GIP agonism or GLP agonism. One area that is becoming particularly interesting is whether GLP-1/GIP dual action or tirzepatide drugs can actually improve outcomes in women receiving aromatase inhibitors by helping offset aromatase inhibitor associated weight gain and metabolic dysfunction. We should get much better recurrence data over the next 5 to 10 years. So to make that simple, the weight gain associated with aromatase inhibitors increases a woman's risk of recurrence of breast cancer. So these drugs may offset that risk. There's a newer class of incretin receptor agonists called retatrutide, which adds glucagon receptor agonism on top of GIP and GLP-1 and has produced even greater weight loss in trials. But long-term cancer and survivorship data are much more limited than for semaglutide or tirzepatide. And I should mention that what I just said about recurrence can be extrapolated into that weight gain increasing the risk of breast cancer for someone who's never had it. But based on what we know today, I am not telling women to avoid these medications because of concerns about breast cancer. However, as always, the decision to use any medication, including these new drugs, should be individualized and discussed at length with your physician.